forever young. I hear the ticking of the clock. Lying here, it's pitch dark.
Okay.
I wonder where you are tonight. No answer on the top.
Well, we're gonna start now. It's 7 o'clock now. And we have replay, and the others can probably join us later on, or they can watch a replay. Let's have here's the one. So can you see it? If you can, please reply yes.
Yes, yes.
Thank you. Right. This is our topic today. Discover acupressure point to relieve neck pain. So now we have to discuss about what is neck pain. So neck pain is so simple, like what's neck pain is so simple, it's just pain on your neck, right? Well, although this is a neck part as well, but we won't call it neck, we call it a throat. So normally generally we call neck pain is all here, right? So it could be pain, it could be numbness, tingling, it could be just achy, dull ache, or it could be just tight. Some people say tight or stiffness, and they describe it as pain as well. So everyone describes the pain differently. In Chinese, it is very different. In pain, we have different pain, like 酸麻胀痛. It's 4 different things to describe pain, but in English, it's just pain, achy, that's it. So, yep, that is neck pain. So neck pain, it could radio to the top, which means you get headache. It could link to your neck, or it come to when you have pain in your neck, it may cause headache. And also neck pain may come together with shoulder pain or upper back pain. Okay, if it's puncture nerve, it will actually go down, some pain down to your arm, or even tingling, pins and needles, or numbness in the fingers. So what does neck pain feel like? Some people describe the pain as a persistent ache, a stabbing or burning pain. So burning normally means that that is compressing a nerve or pinching the nerve a bit more. Okay, a shooting pain that travel from their neck to their shoulders or arms. I just mentioned that. And other symptoms, neck pain may involve other symptoms, including headache, stiffness in your neck, shoulders, and upper back, being unable to turn your neck or tilt your head, numbness or tingling, pins and needles, feeling in your shoulders or arm. So with neck pain, some people describe the pain as well as limitation of range of movement. So the neck range of movement is actually pretty simple. One is forward, backwards, and bring the ear to the side, to that side, and turn that side to that side, and that is the neck movement. And people do this, but in general, in your life, we don't actually do this movement. And this is a very dangerous movement. And we actually don't suggest people to do that because it's very easy to hurt your neck. So if you tilt to one side and you feel pain and it stop you go further, and if you can go further on that side more, that means there's some problem in there. And it later on, when we show you the acupressure point, before the acupressure point, you need to do some examination yourself. I'll show you how to do it later on. Now we're going to do before acupressure point, you're gonna rate your pain, how bad is your pain, and after and then and what position or what movement that it will cause the pain. The pain will be worse, and which movement and any restriction of the movement, and then you can write it down. And then after the acupressure point, and then you move it again and see whether it helps or not. All right, so that's a baby. I'll be closing up. Oh, I think I forgot to record it. Let's just record it now. There you go. I'm recording it now. All right. So again, we started with this one about the structure first, structure imbalance. So I showed that a different picture and lower back pain last time, but I find a picture that actually matched the skeleton here. So as you can see here, this on the left side, this image, this guy is a left shoulder higher than the right shoulder, right? So what's going on? You probably can see here that is scoliosis in here. Yeah, exactly what's going on in here, right? And on the skeleton over here. So left shoulder is higher. So if you see any people's shoulders higher, that means the shoulders off, and the neck's going to be off, the spine going to be off, lower back's going to be off, pelvics, and one leg is shorter than the others. Okay. And as you can see here, this spine should be straight, but it's the neck cervical spine over here. It's not straight. Okay. So that will cause pain in here. So for these people, you may experience pain in the neck, you may experience pain in the upper back, you may experience pain in the lower back, you know. So we couldn't tell unless you come in and then we check, okay, it's this uneven shoulder that causing the problem, right? Now again, very quick in here, spine pretty straight, right? Spine is pretty straight, and that is healthy one. And the thoracic here, like going to one side, and that is thoracic and lumbar going to one side, and that's just lumbar going to one side, and that's combined. Last one's combined. The you see that when the thoracic and lumbar going to that side, this is going to the other side. Okay. So if it just happened in one area, it could going that side, that could go that side, that could go that side, and then the rest of it could be straight, still keep straight. Okay. If it's a combined one, you see that if this upper one going to that side, and that side, the curve going, the lumbar one's going to that side. So it will become that. It'll become one on this side and one on this side, something like that. All right, I hope that makes sense. So that's scoliosis. And a lot of people have a little scoliosis. It's just we didn't just realize it. If you have one shoulder up higher than the other, that is a bit of scoliosis, but maybe not worse enough for people to tell you, hey, your spine is very off balance. Okay. So again, quickly go to this one. With that one, it matched the previous one as well. So with this one, shoulder left side is higher, then it means that the That one is higher, right? So you see the hip bone is higher too, and the neck, we're going to focus on neck today, and the neck is not straight as well. So again, last time we talked about when the shoulder is higher, what does it indicate? It indicates the lumbar is not straight compared with that one, right? But when the shoulder is higher than the other side, it means the neck is not on the alignment, okay? It's not straight at all. So that causes neck pain too. Right. Quickly go to here. So we're talking about structure and neck structure, neck muscle. The neck muscle, as you can see here, there's a lot of muscle in here, right? And those muscle over here, and in the middle, that is spine, cervical spine. And underneath, if we get rid of the white part, that is ligament, and you see that the bone is inside. And that's just the white one in here, and we take it out from here. Okay, and you can see a lot of ligament in between. Of course, there's tendon as well. So in Chinese medicine, ligament and tendons, they are both controlled by liver. Okay, and muscle is controlled by digestive system, which is stomach and spleen. I'll show you later on. So that's structure. Okay, next structure, cervical spine. And as you can see here, cervical, thoracic, lumbar, and this part is a cervical. We have we call C1, C2, C3 to C7. So there is 7 pieces over here. With the 7 pieces, what I'm going to show you is bone. As you can see here, this is all bone. The white part over here, bone. This is bone. This is bone. Bone. It's just a different part of the bone. They call this vertebrae, and the yellow one means the nerve root. And then between the bone here and here, this is a joint. And in the spine, we have intervertebrate disc. Right, so this is just between 2 bone, and we also call joint, but on the spine, we don't call joint, we call disc. Okay, but in any other part, we call joint. And nerve and bone. And bone controlled by kidney, nerve controlled by liver, and joint controlled by liver, and the disc controlled by liver as well, because it's part of the joint. All right, keep going. Well, this is showing that you see all the yellow part. It means that all the nerve come up from the spine, right? To the side, going to the side. Where do they go? They go to your hands, right? They go to the organs. I'll show you later on. Before I show you, this is the normal neck. So a normal neck, it has a curve, right? It's a natural curve, a C, and the C is actually backward one, like this. But that one is a bit straight, okay? Should be this, a C in here. That is the normal curve. Look at the picture over here. This is a normal. We also call it low-dose C's. Low-dose C's, okay? It's a C. And some people, when they come to straight, you see, more straight. And the other one is over here, reverse cervical curve. And that's dangerous. That cause problem. That's cause problem as well. Okay? So that doesn't cause problem. This is natural curve. And this started cause problem. You have pain. And this started cause problem as well. And the question is, can we treat that one? Yes, we can make it back to that one. Okay. Now, you see the curve over here, right? It's the curve over here. What happens is, when we get up in the morning, whatever we do, most of the time, we put our head forward, right? What forward mean? Forward mean, this is a C, right? Forward mean, you see what I mean? This is the spine, right? So we lost the curve. So now this day, computer sitting in here or reading, doing this is not good. So you have to put upright. So put thing in front of you so you don't make your head's not forward. Okay, so that's very important to get your neck pain. Some pain is just a lifestyle problem. It's the postural problem that causing it. Are you following so far? If you are, please say yes or type yes.
Yes.
Thank you. Now, okay, this is just showing that, you see, people were doing 45 degree, 60 degree, 75 degree. Oh, this is just, yeah. You see the neck spine over here is straight, right? On top, it's as a C over here, but when we tilt our head forward, it becomes straight. You know, it becomes straight, and then it becomes reverse, a bit of reverse curve in here, and that's not good, right? Symptoms are caused when the nerve or spinal cord is compressed by the hernia disc, herniated disc. Okay, so probably a lot of people heard about this. More often in the lumbar area, the disc pop out. Okay, but it does happen on neck as well. So you see here, this is normal disc. This is the neck vertebrae, and you see the blue one is the disc. You know, it doesn't pop out. It's a nerve root. The yellow one's a nerve, and on over here, herniated disc, that pop out. And what does it do? It compresses the nerve. So it causes pain. It also may cause tingling, numbness, or pain radiate to the arm. If the disc pop up the center to the back, and normally you get both arms tingling and numbness or burning. If it pop up mainly on one side, then you get one side pain or tingling numbness, depending on which side you get, depending on which side it actually compresses the nerve. Okay. And apart from the disc problem that causing the pins and needles down to your hand, and the spinal cord, with spinal cord, spinal cord mean all the vertebrae that become a whole, like a bamboo that is empty, and it run all the nerve root inside. If it get narrows, and that a compression nerve, it causes symptom as well. Okay, so this is just tell us. You see over here, the sensation over here is from C3. The sensation over here is from C2. So what does it mean? It means that the nerve root, the nerve come up from here, go to sideways. And where did they go? If C1, they come to the head, C3 control here, C4 control here, C5 control here, and C6, it runs down to your thumb. You see, this is C6. You see the C6 over here. Now, C7, it go to here, the two fingers. If any pins and needles come down to those two fingers, right? We know if pins and needle numbness from the neck down to here, this is C6. Those two fingers we know is caused by C7. And if the pins and needles on here is C8, right? So if the pain is only on your head, that from the neck, you have neck pain, it causing pain up here, and then we're going to treat what? We're going to treat C3, C1, or C2. And then when it's come neck over here, we treat C3. So by the symptom, the patient told us where exactly the pain is or the numbness is, and we can track back which vertebrae or which neck, which pieces of that has a problem, compressor nerve. Does it make sense? You don't have to memorize this because this is just letting you know, a bit of idea. How does the nerve connect to hands and head on your neck? Right? So neck problem. So you see that the neck problem may cause what? If the neck has problem, it may cause chest pain or throat problem, discomfort in here. So very rare that patient come in and say that I have tightness in here that's causing from here. Most people think, oh, this is just throat problem, but it could be a neck problem. It could be because of the neck, the compressor nerve, it has some problems, discomfort over here. Okay, so it's very rare, but it may happen. Okay, we can go through that to now we talk about the acupuncture human body meridian, similar to last time that we talk about in lower back pain. And here, you see over here, this color we call dual meridian, and that's bladder meridian. And over the green one over here, we call it gallbladder meridian. Let me show you over here. In the middle, exactly on the spine here, in the middle. So that is what we call dual meridian. Dual meridian control all the yang energy. Yang energy. And on the side, on both sides, is bladder meridian. So this meridian directly connect to your bladder. And on the side over here, it's gallbladder meridian. It runs from the head down to here and go down to the foot. And but when it comes to the side, okay, on the side here, and come to the side, it actually go into inside the organ and connect to gallbladder. That's why we call it gallbladder meridian, right? So that was 3 main meridian we treat neck. Okay. If the pain come to here, the back of the ear, some pain is actually come to here, but normally what pain is just come to here, this area. If the pain come to here, okay, if the pain come to behind your ear, you have pain over here. This is dual meridian, there's bladder meridian, this is gallbladder meridian. If pain further on, it come to here behind your ear. I have pain behind the ear, as well as neck pain, and we know this area is different. We call Sanjiao meridian. Sanjiao meridian is we control the yang energy as well. It connect to the kidney. Okay, kidney store the original yang energy, which is original energy that when we born, that we get the energy from our parent. Okay, according to Chinese medicine, and that energy is stored in kidney. But when it run past to your body, it run past through Sanjiao meridian. Okay. Hi, Faye. Can see you. You here? Hopefully, you can hear us. Okay. Now, let's go to here. This is more interesting. Again, this is just Chinese medicine. We have this, and not in Western medicine. Heart and small intestine, they both are twin sister. Spleen and stomach, twin sister again. Lung, large intestine, twin sister. Kidney, bladder, twin sister. Liver and gallbladder, twin sister. You can say twins brother if you wanted to. Over here, okay, as you can see here, those heart and small intestine, they both control the physical function. They have physical functionality in here. And also, if they are out of balance, most people feel unhappy. So there's also a connect to emotional energy. Okay, like stomach and spleen, when they're out of balance, it may cause anxiety. But when stomach and spleen are out of balance, it may not cause anxiety. It maybe cause some pain in the muscle. And the muscle pain could be in your neck, could be in your stomach, could be in your leg, could be in your lower back. And patient asked me, when the stomach and spleen, they're weak, why would that pain in the lower back, not in the tummy? And I said, because the stomach and spleen control the entire body muscles, and then whichever weaker muscle, if the lower back muscle is weaker, then the pain will appear on the lower back. Or if you have more stress on your neck muscle, and the pain will appear on your neck muscle. So you may not get the whole body pain. But with fibromyalgia, they do have a lot of pain. It's actually entire body. That's in the muscle pain, fibromyalgia. And those patients definitely have a stomach and spleen problem. Okay? Most of them come with the digestion problem, either bloating, acid reflux, or bowel motion, either constipation or loose bowel motion, like few times a day or up to 10 times, even more. It could be watery. Okay. Now, for the structure we mentioned about today is, well, previously we mentioned about the neck muscle right? That's controlled by the stomach and spleen. We mentioned about bone, vertebrae, cervical vertebrae, the spine. It actually controlled by the kidney because of the bone, the string. Okay, and the rest of it, this joint, tendons, ligament, nerve functioning, they all controlled by the liver. So therefore, we, as an acupuncturist and Chinese medicine practitioner, when we treat pain, we don't just treat, do some massage, put some needle over here. We look at the full body. We want to understand how the organs are functioning. If the pain over here, and then the patient have tingling and numbness down here, we know it compressed the nerve. It's a structural problem. We don't just treat here. We want to make sure the liver is functioning properly because it's hurting the nerve. And when there's nerve pain, that means you want to reverse the nerve functioning. You want to treat the liver, not just get rid of the pain here and just massage over here. That's not good enough. Okay. And when we treat muscle problem, is the muscle pain over here. Apart from acupuncture point over here, or doing some distal point, which I'm going to show you the acupressure point. And we want to make sure the stomach and spleen are functioning fine. What I mean is, if you having treatment with us, if you have neck pain and that's a muscle problem, and at the same time you have digestive problem like bloating, acid reflux, or diarrhea. And while the treatment, we want to see that your stomach and spleen function improve. How do we know it's improved? For you, you can look at your bloating. If the bloating decreased, that means increasing, the function is increasing. If the acid reflux is less, that's better. If you go to toilet for bowel motion about 4 or 5 times, and when it comes down to 2 or 3 times, that means improvement. Now, this is for patient. We teach patient how to look at the improvement. For the practitioner, we don't just rely on the symptoms for the measurement. We actually take the pulse, look at the tongue, and see the difference. And this part I probably talk about in the future. Talk about how do we figure it out from the pulse, how does the pulse actually connect to the organs, and how does the tongue connect to the organs. Okay. Okay. Next, we go this one. So the energy is very interesting one. So we call lung. If lung out of balance, you get sadness. If kidney out of balance, you get fear. If liver out of balance, you may get anger, depression, irritability, stress, impatience. Okay. So all this emotional energy is linked to one organ. What does it mean? It means that if spleen out of balance, you probably worry a lot. And then toward to that, you get anxious, even worse. And then start to get scared things happening. And then that will move to fear. So anxiety, worse, scare, and then become it actually harming the kidney. So another way, if you had a healthy spleen and kidney, if you worry a lot, you keep worrying about things, and just 1 or 2 days or a short time is fine, that's okay. But if the things you keep worrying for a long time, and then that actually will harm the spleen function. Okay, I hope that makes sense to you. This is just the symptoms, like if the physical functionality out of balance, and you may get all the symptoms, right? For example, lung, you may get shortness of breath, coughing, wheezing, sinus, sneezing, sore throat, mucus in throat or chest, skin raise, itchy skin, eczema, diarrhea, or constipation. Okay, well, let's just go to the next one. So, I'm going to show you acupressure point, distal point to relieve your neck. But before that, you need to understand what the acupressure point is going to do with you and what's the theory about that, right? So there is a theory in acupuncture. It says that if there is a blockage in the channel, or we call meridian, and there's pain. If the channel flow very well, like the energy and the blood flow very well, and there's no blockage, and there's no pain. Okay, so that is basically we base on that theory, and we use acupuncture, acupressure, massage, or whatever, put heat pack. What are we doing? We try to unblock the channel. So whatever we do, we try to unblock the channel. So therefore, we have for unblocking the channel, the meridian, we have an acupuncture technique called balance method acupuncture. So with balance method acupuncture, it is a strategy that choosing the distal point to work for the pain. Like, for example, neck pain. If you choose any point around the neck and needle it or massage it, we call local point strategy. But for the neck pain with balance method acupuncture, we don't do local point. We can do the point on the hand, which I'm going to show you later on. We can choose the point on the feet or scalp or even in the tummy to increase the circulation, to unblock the blockage over here to achieve pain relief in your neck. So that is balance method acupuncture. And now we're going to do is balance method acupressure. Are you following so far? If
Yes.
you do, good.
Yes.
Okay, cool. Thank you. Okay, that is just for the meridian, what we're working on. But we know that the structure and balance, we keep talking about uneven shoulder and things like that. If you look at here, you know the spine is off. And for the balance, the rebalance the structure, we have another technique we call GE structural acupuncture technique. Okay. And with the structure, we really want to do the needle on the muscle or tendon, or sometimes the needle actually going to touch the bone. Okay. With the structure, there's one thing that we need to understand. The bone never move. The skeleton gonna stay in there. If you don't move it, it can't move itself. It moves because of the muscle contraction. Okay, we have muscle over here and muscle over here. When the muscle contract over here, let move. And the muscle here, let go. All right. So what happens is, if I want to straighten my arm, the muscle over here contract, and this muscle now need to let go. Right? So this is a bit of, we call that yin and yang. All right. So this is, I want to share with you yin and yang. It's yin and yang everywhere. Okay. Now, yang means energy. Right. And it also means move. And that is silent. All right. Compared with energy is actually what we call it, and we call water, because energy is hot, heat. Okay. And one is move, one is silent. One is strong. We call this yang is strong, and that's weak. Okay. So when we do this, the contraction mean yang, and then let go mean in. In movement, let go. Yang movement, contraction. And we do this movement, the muscle over here contraction, the muscle is doing yang, and this is doing in movement, let go. All right. So there's a bit of Chinese medicine theory in there. Right. So I want to show you back here. So over here, you can see here, that means some muscle over here, pull this neck joint over to that side, and over here probably pull it to that side. That's why it become a curve. Okay. So going there, there's some muscle over here differently tight. So we want to get the structure acupuncture to go to the local area to release the muscle. And we're going to come to here to release the muscle as well. And we can't just do on the neck. For the structural acupuncture, we have two strategies. One is a local point strategy to work in this area. The other is distal point strategy, which may do it on your lumbar or hip or on your foot. Okay, because foot is uneven. The foundations on the foot, the foundations on here, they're causing this neck out of balance. So when we look at the big picture, we don't just massage the neck. Massage the neck will help to relieve the pain, but it's not going to fix the problem. So the problem, you need to look at the full body and choose some point over here and some point on your leg, some point over here for the structure to be more balanced, and eventually the pain will go away, it'll be more stable, and the lasting result will be better than just putting needle on the neck. Okay, that is the structural acupuncture. Organs functional imbalance. And we're going to rebalance the organ, of course, and we do post-organ functional acupuncture. The reason we do here is we understand that stomach controls the muscle. If this patient is muscle pain and we take the pulse and we find out, okay, the pulse 3 fingers over here, with 3 fingers here. And this side is stomach and spleen, this side is liver and gallbladder. And when I put my fingers on, I should feel the pulse over here. At the same time, I should feel the pulse on that side as well. But if I feel the pulse on that side first, and I can't feel the pulse, and I have to dig deeper, and I start to feel the pulse, what does it mean? The stomach and spleen is weak, and that means that the liver and gallbladder is strong. So by doing the blockage, meridian blockage, let me show you again. Right, with a meridian block, your body can't transfer the energy and blood properly. It may cause the organs imbalance because the organs don't get enough energy to nourish the organ, so the function will change. Also, if the structure out of balance, let me show you. Right, if I tilt it that way, this is the liver and gallbladder. If my body tilted that way, I compress this liver and gallbladder, what's going to happen? The liver and gallbladder, it's going to move harder, work harder, because something is actually compressing it, and they have to move harder, try to get rid of something, but which they can't because the full body actually compressing it. So therefore, this liver and gallbladder work harder, they're overactive. That's why we feel the pulse over here stronger than here. And when they're overactive, it against the stomach and spleen function. Okay, so that is a structure causing the stomach and spleen problem. If the structure is good and the meridian blockage is gone, then you still have pain. Then we check the pulse. Okay, now the others are good. It's just the pulse still uneven. That means it's the organ functional issue that we need to treat the organ. And we just simply put a few needles on certain point. It's a very gentle one. And then we check the pulse. After the needle, if the pulse was from there back to here, that means the function is better. Okay, that is pulse balancing acupuncture, which is targeting the organ function. right? This is three main acupuncture. We look at full body, we treat the membrane blockage, and we treat the structural imbalance, we treat the organs functional. Right, this is another way to look at the structure, and we were talking about one leg shorter than the other, and that one is just another type of structural problem. So there is three different structural problems we can tell from the foot. Okay, and this is showing you that with the structural acupuncture that it can treat the scoliosis. And that one is, I just happened to find the picture today. We talk about over here. Right, this is a natural curve, right, of the cervical. And when you lost the curve, it becomes straight. And that could be the problem that causing the pain. Okay. Then can we do that? We have to apply GE structure acupuncture. So this is the before, pretty straight, and this is after the acupuncture. You see it come back a little bit, a bit of curve, so that's better. So that, if you look at here, it's not just straight, it actually go a bit of reverse, right? And that is going to that way now. So to coming the curves coming back a little bit. Okay, so but not just with the acupuncture. Okay, the patient need to do some homework, right? Especially when you sleep on your back. Okay, sleeping on the back, people like to put high pillow. So we see we want to maintain the curve, right? And we sit properly, and then we tuck the chin in, the curve will happen beautifully. We forward the head, we lost the curve, right? This is what happened. We forward, we lost it. But what happened now is during the day, you read, you sit in front of the computer, you look at your cell phone, you know, most of the time we do head forward. But in the sleeping time, about 8 hours, 5 hours, we put high pillow. Look, the pillow is too high, and we lay on it, it pushes the head out. We still lose the curve, right? So very important that your pillow should not be too high. Or even though I suggest do not use pillow, use a towel or a good pillow that actually just support your neck. And then you can maintain the curve, and that's one thing that can help neck pain, to help the curve, to get the curve back. So that's important. At first, it's very discomfortable because you got used to it with pillow, but it will get better and better and better. If you need to know how to do it, you can come to us and we can show you how to do it and how to adjust the right height of pillow on your neck. So that's very important one. With the treatment, you must look at the pillow. Otherwise, especially for those patients, for you, that if you feel pain when you sleep at nighttime, if you get pins and needle and numbness, if those pins and needles numbness wake you up, so that you definitely want to look at your pillow. You don't have to buy an expensive pillow. This is just, I showed you last time, this is just GE acupuncture treat the scoliosis. This is before and this after. Right, today we're going to show you the acupressure point. I showed you last time on the lower back. Right. So over here is lower back, neck is over here. So that is the fifth metacarpal bone, and over here there's the second metacarpal bone. You see the neck and shoulder over here. So that means if that is treating the neck, that's treating the neck, the rest of it over here is going to treat the neck as well. Okay, how do you locate it? Let me show you. Over here, 1, 2, 3, 4, 5. So we call it neck 5 points, instant relief neck pain. Right. Let me show you how do we do that. So I suggest to use this tool. Okay, you can use your thumb, you can use your knuckle, and I normally do this on the top over here. If you make a fist, you can see that there's a crease over here, this one, and exactly over here. That's the first point. So we press over here, closer to the bone, next to the bone, and press it up and down or go sideways. Right? You can use your thumb to do that. You must find the painful spot, otherwise it doesn't work well. You use a knuckle, you go up a bit, you go down a bit, you go sideways a bit, you closer to the bone, and you dig a bit deeper. When you feel the pain, the spot, you just gentle rub it, not too hard, keep the pressure and rub it for about 30 seconds. And then you off that after 30 seconds, you go to that one and press, and between the 5th and the 4th metacarpal bone, find a painful spot, up a bit, lower a bit, find a painful spot and do it for 30 seconds. Same as over here, 3rd and 4th metacarpal bone, do that one. And same as the 2nd and the 3rd one over here. And over here, it's just closer to the 2nd metacarpal bone. And again, next to the bone, just like that one. And press for 30 seconds, right? Very gentle, not too hard, but you want to feel the tension, a bit of pain in there, and keep rubbing. Now, before you rub over here, you can do it now. You ask yourself, before you need to you test it out. Either hand will work. Okay, you need to test out. You ask yourself, where is the neck pain? And you go your hand and touch, and try to touch. If you feel some spot painful, and then you ask yourself, how bad is the pain? And then you write it down. Let's say it's 6 out of 10. If I'm not moving, 6 out of 10. If I press it, oh, quite painful, 8 out of 10. Right. Then when you move, oh, it's very painful over here. I can't go any further. There's 10 out of 10. Right. And that way, no problem. That way, no problem. That way, no problem. And push it here, no problem. Over here, oh, that's very painful. 10 out of 10. So 2 movements, that way, 10 out of 10. I'm just pretending at the moment, okay? And then you start to work all this point from here to here, or you can from here to here. You can start from here to here to here. Doesn't really matter. Work on that after 30 seconds on each point, and you start to move it again. And you ask yourself, how's the pain right now? Oh, it was 6 out of 10. Now down to 4 out of 10 or 3 out of 10. That's good. And you go and touch it. Or it was 8 out of 10. Now I'm touching is only 5 out of 10. That's improving. And you go, oh, still can't go that far, but the pain is not as bad. Or you can go further from 10 out of 10, now down to 6 out of 10. That's good. And you go that, oh, 6 out of 10 as well. That's good. That's improving. So what else can you do? Next, do a now. You can go for 1 more time or 2 more time over here. Right, and then lift it and put a heat pack across your neck, because the heat pack would help more circulation to your neck and to release the pain and improve the range of movement. Okay, apart from the acupressure point, you can do heat pack around your neck. Okay. Does that make sense? Are you following?
Yes.
Okay, cool. Apart from that, there are things that you can do. Heat pack. Yeah, let me show you some other points. So generally, the neck pain, it comes with very tight because the muscle is a whole muscle, the trapezius muscle, it's all the same over here, it comes to the shoulder. Okay. Then what you want to do is, if your shoulder, you look in front of your mirror, if your shoulder that size higher, then you want to choose some local point, and the local point is over here. You go here and massage this one. Even though the pain is over here, you want to massage that one. And guess what? When you massage, if you do it well, the pain here will subside after you massage that one. Because massage here is just to loosen up and push your shoulder down. This is just local point. Of course, if you come for acupuncture, it's not just doing that one. We know we needle here, we needle your leg as well because the structure out of balance. But something they can do, the local point, we do this one. Okay. Now, if the pain is on here, if the shoulder is higher on that side, then you just do that one. Right. But most people will say, oh, the pain is over here. Now I'm going to massage that one, even though the shoulder is high on that side. Okay. Most people will do that, you know, and most practitioners will go, oh, pain is over here, we do here. You can do here, no problem. If you want to massage here with the pain, you feel better. Right. Let's say I massage 10 times. Then what do you do on the other side? Massage 20 times. Right. If you just want to do 10 times, do it on that side because the shoulder is higher. Forget about that one. Just put hip pain here. Right. Because if the shoulder is lower in here, you massage here, you get relief, no question, but you're never going to fix it. Because you just keep losing, because that muscle is loose on that side. And that side is tight, but the pain is actually on the loose muscle in here. And you keep losing the muscle, losing that, relaxing, more relaxing, but the muscle is still tight over here. It's never going to fix the problem, according to the structural imbalance. That's why we say that if the shoulder over here higher, you mess up that one, not that one. Okay, there are more points, but that is the other structural imbalance, and you can't check it. The easier way is just look at the shoulder for those 2 points. Okay, I hope that helped. Another thing, if you have very tight upper back, because the neck pain going down, then the scapula on the back, you put your both hands in the back like this and squeeze the scapula together. And count to 5. 1, 2, 3, 4, 5, and relax. And squeeze together. And relax. And squeeze together. And relax. Further on, if you squeeze together, you can your head backward. And it will help even further. Relax. And they will help to release a lot of pain on the upper back. Okay, they just squeeze very hard and hold it for 5 seconds. Make sure when you hold for 5 seconds, you breathe through your nose or your mouth. Or keep breathing so you get oxygen in and it'll go into the muscle to relax the muscle. Right, that's about it. Any question? So again, we're offering one free quick acupuncture. If anyone want to take it, you can call us 0800 221 224 or email us info@balancetcm. So if you are a previous patients, you haven't been to us, no problem at all. You can still get the free quick acupuncture. We actually put it on every year, started from January to February. Every of our customer, you can get a free quick acupuncture from us. Okay, like 2023, you can get a free quick acupuncture from us, and then when it comes to 2024, you can come back and get another free quick acupuncture. Right? It's normally just we mainly do the either structure, GE structure acupuncture technique on you, or we do the Meridian blockage, because those two techniques we don't have to man a needle, we can just in and out quick needles. But with the post balancing one, we have to lift the needle for about 15 minutes at least to let the organs work. All right, so that is different. So we offer 15 minutes up to 15 minutes quick acupuncture for free for everyone. Okay. Anything else? Thank you and have a good night. Any question at all? If you have a question, you can ask now. Any question?
Thank you.
No? Okay, good. Thank you very much for your time. And this will be as it is recording, and I'll send everyone a link for those people who join up. We probably have about 20 people sign up today, but only one people appearing here. But that's good. Two people it was here. All right. So thank you very much for your time, and I'll see you next week. See ya. Bye bye.